Grant, Trin, and Alexa in Justice 225, and we are here to talk about the topic of discrimination that the LGBTQ plus community faces in the context of healthcare.
Okay. Have you ever felt discriminated against due to your sexual orientation or identity?
Yes. It's usually when I just meet new people and they find out that I'm gay. It's always kind of like a step back, or like they feel a little bit more reserved, especially straight males. It's out to you guys. Yeah, basically.
Have you ever withheld information about yourself from others due to fear of discrimination?
I feel like it's happened sometimes just because, like I said, when people, like straight males or stuff, find out that I'm gay, they kind of assume that I'm going to hit on them or become sexually attracted to them when it's like, maybe I just see you as a friend.
Are you satisfied with the work being done to help the LGBTQ community?
Yeah, I feel like it's definitely taken a stride, bigger strides forward through the centuries and stuff. And I feel like we've come a long way since, like the Stonewall riots and not being able to get married and stuff like that. So yeah, I'm pretty happy with it.
Have you ever felt discriminated against?
No, not personally. I feel like I've had a really good experience, but I know that that's a very rare circumstance, and a lot of people do face discrimination every day.
Have you ever withheld information about yourself to a doctor to not be discriminated?
Yes. There's definitely been times like at the OBGYN or just at the general physician's office where they've asked, if you're sexually active or not, and it's just kind of an uncomfortable question. So instead of just like volunteering the fact that like I'm actually gay, I'll usually just say no.
Are you satisfied with the work being done to help the LGBTQ plus community?
I think that we've taken a lot of strides, especially in recent years. I think that our society is becoming a lot more progressive and accepting of all sexualities and gender.
So according to a study done by the Center for American Progress in 2017, approximately 8% of lesbian, gay, and bisexual individuals reported being denied needed health care outright. And then a study done by National Women's Law Center found that of LGBTQ plus members who visited a doctor in the year prior, 8% were refused to be seen due to sexual orientation, 9% were treated with harsh language by the doctor, 6% said that a doctor or other healthcare provider refused to give them health care related to their actual or perceived sexual orientation. In January of 2018, the U.S. Department of Health and Human Services issued a proposed rule that would allow medical providers to refuse care for religious purposes. This is concerning for the LGBTQ plus community as it doesn't require religiously objecting doctors to refer patients elsewhere. Over 1 in 5 LGBT individuals reported withholding information about their sexual practices from their doctor or another healthcare professional. So what can we do about this? There are numerous ways that we can all help to eliminate LGBTQ plus healthcare discrimination. The main way is through education and awareness. Providing medical students with training to increase provision of culturally competent care is a great way to prevent LGBTQ plus healthcare discrimination. And in the school setting, we could implement more anti-bullying policies against students who are in the LGBTQ plus community. Policy change is a great way to go, either whether it be federally, so nationally, locally, state level. Those are all great ways to lobby for that policy change. And then here at JMU, there are many LGBTQ plus organizations that you can join or learn more about to support the community. Examples of those are BGTQ and Ally education program that has a hangout and relaxation space in SSC. It puts on awareness and educational activities, and it has a whole resource library for you to learn more about the community. There's an organization called Madison Equality that meets every Tuesday at 8 p.m. in SSC to promote education and awareness about the LGBTQ plus community. So given all of this, we thoroughly believe that according to the 14th Amendment, we all have access to equal rights, and that just because a citizen is a part of an LGBTQ plus community, they should not be denied their right to health care. Thank you.